You said, doctor, that it's very important for early detection. And most of these high-risk patients, they would like to go for the test. They should be going for these tests called serum creatinine and urine protein. So the reason for this early detection, is it because that it can be reversible? Is this, in the early stages, is the kidney disease reversible? And what stage is it irreversible?
Okay. So that's a very nice question, because I passed out of nephrology in 1997 as a student. And my firm understanding today is majority of the kidney diseases are reversible, provided you pick them up early. And when we say early, what do you mean by early?
Early.
So once the creatinine goes up, I want to make this as the main message of today. Many of us may be aware our serum creatinine is 1.5, let us say. So 1.5 is double the normal reading. So this, even among the doctors, awareness is not that much. Most of Indians, serum creatinine, the normal is 0.7 or 0.8. Many labs give it as 1.4 or 1.5 is their normal, which cannot be true, because by the time I get to 1.4 or 1.5, I have actually doubled my serum creatinine. Other thing that we should know, serum creatinine is a marker of kidney function. It is not produced by the kidney. It is actually produced as a end metabolic product and is excreted in the kidney. So we actually use it as a surrogate marker of the kidney disease. So the actual marker of kidney function is what is called as a GFR. Yes. Let us assume my GFR is normal. My serum creatinine is 0.7 or 0.8. My GFR drops to 90%. My serum creatinine is still 0.7 or 0.8. My GFR drops to 80%. My serum creatinine is still 0.7 or 0.8. What I'm trying to drive home is, when you are focusing on serum creatinine, by the time it becomes 1 or 1.1, you have actually lost 25 to 30% of your kidney function. Keeping this in our mind as background information, as long as your creatinine is below 2, most of the times your kidney disease is reversible, eminently reversible. And when I say 2 creatinine, many of us think it is mild kidney disease, but 2 creatinine is 50% of the kidney function already dropped. Because the doctors themselves do not understand this, we pick up our kidney disease very, very late. In our day-to-day practice, we see patients 4 years ago, their creatinine was 1.3 and it was not highlighted and nothing was done about it. Unfortunately, by the time they come to us, it is 3 creatinine or 4 creatinine and we cannot do much. Just for our discussion sake, let us say most often when the creatinine is 2, around that, it is very eminently reversible. Having said that, there are certain diseases where even a patient comes to us at 3 or 4 or 5, we are able to reverse the disease totally, because there is an acute insult and the patient is going through acute worsening. When it is a chronic insult for over many years, I would say between 2 and 3 is where we say it is reversible. But even beyond that, many of the times we are able to arrest the progression of the disease at that level so that the patient does not progress further requiring dialysis.